You are very welcome. Today we are going to watch the video What is Serotonin Syndrome? Symptoms and Treatment video. Serotonin syndrome is a potentially life-threatening condition that occurs when serotonin levels in the brain become too high. In this video, we will discuss the symptoms and treatment of this syndrome in more detail. The video will help you learn more about the topic. Serotonin is a chemical substance produced in the body that is essential for nerve cells and brain function. Excess serotonin in the body can cause symptoms such as chills, diarrhea, muscle stiffness, and fever. In such a case, treatment should be administered quickly, as neglected serotonin syndrome can be life-threatening. Mild serotonin syndrome can return to normal within a few days after stopping the medication, while in some cases the patient may need to take medication that blocks serotonin. Serotonin syndrome is a life-threatening reaction caused by the accumulation of more serotonin in the body than it should be, as a result of excessive consumption of drugs and supplements containing serotonin. Serotonin is produced by nerve cells in the brain and other parts of the body, regulating digestion, blood flow, breathing, behavior, and body temperature. Serotonin deficiency can be restored to normal levels with medication prescribed under the supervision of a doctor. However, taking a new medication or increasing the dose of medications that increase serotonin levels can cause serotonin syndrome. Today, there are many drugs that affect serotonin levels. Uncontrolled use of these drugs also causes an increase in cases of serotonin syndrome. Symptoms of serotonin syndrome vary depending on the severity. Symptoms usually start a few hours after a new medication or an increase in the dose of medication. Symptoms of mild serotonin syndrome include restlessness, insomnia, blurred consciousness, fast heart rate, high blood pressure, dilated pupils, loss of muscle coordination, muscle stiffness, sweating, diarrhea, headache, tremors. Symptoms of severe serotonin syndrome, which can be life-threatening, include high fever, tremor, seizures, irregular heartbeat, unconsciousness. Taking timely measures against serotonin syndrome, together with the symptoms that occur depending on its severity, has a great potential to prevent its progression. Prescription or over-the-counter medications. Herbal or dietary supplements, illegal substances, and drugs increase the risk of serotonin syndrome. Serotonin syndrome, which can be seen in people of all ages, sometimes occurs with the intake of a single medication, while in other cases it occurs when certain medications are combined. Antidepressants taken together with migraine medication, or taking a painkiller and an antidepressant can cause serotonin syndrome. The following conditions increase the risk factors for serotonin syndrome. Taking or increasing the dose of a medication known to increase serotonin levels. Taking multiple medications known to increase serotonin levels. Taking herbal supplements that increase serotonin levels. Taking banned drugs or substances that increase serotonin levels. There is no test that can definitively diagnose serotonin syndrome. However, the diagnosis can be made by physical examination of the doctor, questioning the symptoms and medications used by the patient. Blood and urine tests may be requested to measure the levels of medications used by the patient. Treatment of mild serotonin syndrome can be done by stopping the medication or changing the dose. In moderate serotonin syndrome, the patient is hospitalized for a day under the supervision of a doctor, and the medications or external supplements that cause serotonin levels to accumulate in the body are taken under control. In severe serotonin syndrome, the patient is hospitalized in the intensive care unit where body and organ functions can be closely monitored. Sedatives are used to relieve symptoms such as muscle stiffness and seizure-like movements, for fluids to control high fever, oxygen through a mask to improve oxygen levels in the blood, and drugs to control heart rate and blood pressure. Treatment of serotonin syndrome is determined by the severity of the disease. If serotonin syndrome is not treated, very serious problems can be encountered in the later stages, especially serotonin deficiency or elevation, which acts as a transmission between the brain and nerve cells, directly confronts psychological problems. This can lead to an increase in conditions such as very serious depressions or excessive irritability over time. It can even become life-threatening.